Bez, do you require an ultrasound scan for removing a cyst from the neck? So, good question this. So, neck lumps, as a rule, there are certain areas where you get a lump where you think, crikey, what is that? That could be several things. I think we need a scan. So big lumps over the spine, kind of very large lumps around the abdomen, around the chest, around the thorax, and the neck is quite an important area where there's quite a lot of things a lump in the neck could be. The interesting thing about this question is they're saying a cyst from the neck. So basically, when you have a lump, assuming it's underneath the skin, so it's not a skin lump. So if you've got a skin lump, if it's a, you may know what it is if it's sticking out the skin. But if the skin looks normal and it's underneath the skin, the distinction between a cyst and a lipoma and a lymph node and all the other neck lumps it could be are that the cyst is attached to the skin, whereas a lot of the more kind of I guess worrying lumps in the neck are deep to the skin. So, if it's, for instance, a lipoma, that's deep to the skin. So you can move the skin over the lump, whereas a cyst is kind of connected to the skin. So if it's really is a cyst, and if it is obviously connected to the skin, and particularly if there's a little puncture, a little hole where you can see there's a connection to the skin, then you wouldn't need a scan if it's an obvious cyst. But if it's not an obvious cyst, if you can move the skin over it, or if it's difficult to tell whether you can move the skin over it, and there's not a punctum, and there's any sort of debate as to whether it's a cyst, it would be worthwhile getting a scan. But I wouldn't say carte blanche, you should get a scan for all neck cysts, because some might be an obvious cyst in the skin, and you can tell that that's going to that's not going to be anything else. But if it's a subcutaneous lump that's not obviously connected to the skin, it's quite mobile, could be something else, you would probably be wise to get a scan, because, as I say, there's lots of things in the neck. There's blood vessels, there's nerves, there's lymph nodes, there's muscles, there's esophagus. So there's a lot of things that could cause a swelling or a lump in the neck. So you have got to be a bit careful with the neck. But as I say, an obvious cyst, so that would be one that we might be able to tell on a photograph, or you might have to come in and we'll examine you and say, look, we'll have a look, and if it's obviously connected to the skin and a cyst, then yeah, we don't need a scan. But if not, then we may well ask for a scan.